Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Look at the neck for a moment, not only as a stack of bones, muscles, discs, and nerves, but as a living communication center. Every time you look down at a phone, clench your jaw, sleep poorly, work under pressure, or hold your shoulders slightly lifted for hours, the neck receives the message. At first, it may answer with stiffness. Then, it may answer with tightness. Later, it may answer with pain that seems too intense for what the scan shows. So ask yourself, why does neck pain sometimes stay even after the original strain should have healed? How does a small, daily nutritional intervention like krill oil rich in omega-3 become part of a serious strategy for comfort, mobility, and recovery? Start with this command. Do not think of krill oil as a magic painkiller. Think of it as a biochemical support tool. It does not replace posture correction, strengthening, sleep, medical assessment, or physical therapy, but it may help change the inner environment in which pain is being produced. Medical literature has been moving toward a deeper view of chronic neck pain. A systematic review and meta-analysis in the European Journal of Pain found that chronic neck pain can be associated with higher inflammatory markers, particularly interleukin-1 beta and tumor necrosis factor alpha, although the quality of evidence was limited by small samples and variation among studies. In plain language, for some people, neck pain is not only mechanical, it may also carry an inflammatory signal in the blood. Now ask, why does that matter? Because omega-3 fatty acids, especially EPA and DHA, are not just healthy fats, they are raw materials the body uses to shape inflammatory signaling. And krill oil delivers these omega-3s in a phospholipid-rich form, meaning they are packaged in a way that interacts closely with cell membranes. So today, listen carefully. Do not reduce this topic to take a capsule and the neck gets better. Go deeper. Ask, what is the neck asking for? What is inflammation doing? How can omega-3 help the body turn down the volume without shutting down the alarm system completely? First, understand the pain. Most neck pain is not one single thing. It is usually a layered condition. There may be tight upper trapezius muscles, irritated facet joints, stiff thoracic spine mechanics, weak deep neck flexors, overworked suboccipital muscles, poor sleep, stress chemistry, screen posture, old whiplash, or low-grade degenerative change. But here is the part many people miss. Pain is not produced by tissue damage alone. Pain is produced by a nervous system interpreting danger. Ask, why can one person have a terrible-looking cervical MRI and little pain, while another person has strong pain and only mild imaging findings? Because pain is not just an image, it is a biological conversation between tissue, immune cells, nerves, spinal cord, and brain. Inflammatory mediators such as prostaglandins, cytokines, and chemokines can sensitize nerve endings. When those nerve endings become sensitized, normal movement may feel threatening. A small rotation of the neck may feel sharp. A long workday may feel like a flare. A night of poor sleep may turn mild tightness into burning discomfort. Reviews of neuroinflammation and chronic pain describe how inflammatory mediators can contribute to peripheral and central sensitization, meaning the pain system becomes easier to trigger and harder to calm. So give yourself this instruction. When neck pain becomes persistent, stop asking only, what structure is damaged? Also ask, what system is sensitized? Now bring in krill oil. Krill oil contains EPA and DHA, the same major marine omega-3 fatty acids found in fish oil, but krill oil has a distinctive feature. Much of its omega-3 content is bound to phospholipids. Cell membranes are built from phospholipids. That matters because inflammation is not floating in empty space, it is coordinated at the cell membrane. When fatty acids are incorporated into membranes, they can influence what inflammatory molecules are produced. Ask, how does that connect to pain? Here is the sequence. Omega-6 fatty acids, especially arachidonic acid, can be converted into inflammatory eicosanoids, including prostaglandins and leukotrienes. These molecules are not evil. The body needs them for defense and repair. But when the balance tilts too far, they can help keep pain pathways awake. EPA and DHA compete in this biochemical space. They can shift the pattern away from more aggressive inflammatory signaling and toward molecules involved in resolution. That word, resolution, is essential. Do not think only anti-inflammatory. Think inflammation finishing its job. Omega-3 fatty acids can be converted into specialized pro-resolving mediators, including resolvins, protectins, and myrisins. These compounds help the body move from alarm to repair. Reviews of omega-3 biology describe these pathways: reduced production of certain arachidonic acid-derived inflammatory mediators, lower expression of inflammatory cytokines, and increased production of resolution mediators derived from EPA and DHA. So ask, why might this help a painful neck? Because a painful neck often lives in a cycle. Irritation creates guarding, guarding creates stiffness, stiffness creates more irritation, and the nervous system becomes more watchful. If omega-3 helps reduce the biochemical pressure around that cycle, movement may become easier to reintroduce. And movement is not optional. Movement is medicine for most non-specific neck pain. Clinical guidelines emphasize activation, education, and exercise as central strategies for non-specific neck pain, especially when there are no red flags suggesting serious structural disease. For chronic neck pain, exercise therapy is consistently recommended. Analgesic drugs may provide short-term relief, but they are not the foundation. So use krill oil in the right place. Do not use it instead of movement. Use it to support movement. Take the oil, then train the neck. Restore rotation. Strengthen the deep stabilizers. Open the thoracic spine. Relax the jaw. Lower the shoulders. Walk daily. Breathe slowly through the nose. Ask, how can the capsule create an opportunity for better behavior? That is the practical point. Now let us look at the evidence in joint pain. A 6-month randomized, double-blind, placebo-controlled trial in adults with mild to moderate knee osteoarthritis tested 4 grams of krill oil daily. The krill oil group had a significant increase in omega-3 index and modestly greater improvements in knee pain, stiffness, and physical function than placebo. The study did not show major differences in inflammatory markers or NSAID use, so interpret it carefully. The benefit was measurable but not dramatic, and it was shown in knees, not necks. Now ask, why mention knee osteoarthritis when we are talking about the neck? Because it gives us human clinical evidence that krill oil can influence musculoskeletal pain outcomes in at least one joint condition. It does not prove that krill oil treats neck pain directly. Be precise. Say this: the evidence supports a plausible adjunctive role, not a standalone cure. There is also conflicting evidence, and you must respect it. A later randomized clinical trial in knee osteoarthritis found that 2 grams per day of krill oil did not improve knee pain compared with placebo over 24 weeks. That matters. It tells us dose, patient selection, baseline omega-3 status, disease severity, and study design may change the result. So command your thinking. Do not oversell. Do not dismiss. Place krill oil where it belongs, a supportive nutritional strategy with biologic plausibility, some positive musculoskeletal data, and some negative trial data. Now let us examine why krill oil may be attractive compared with ordinary omega-3 sources. Krill oil's omega-3s are largely phospholipid bound, and a 2026 double-blind randomized trial in healthy adults reported that krill oil increased plasma omega-3 fatty acids more than fish oil over 12 weeks. Older bioavailability studies have shown mixed findings, with some suggesting comparable uptake when EPA and DHA doses are matched, so the fairest conclusion is this: formulation matters, dose matters, and the individual body matters. Ask, how do you turn that into action? Do this. Look at the label, not just the front of the bottle. The front may say 1000 milligrams krill oil, but what matters biologically is the EPA and DHA content. Two products may look identical and deliver very different amounts of active omega-3. Choose a product that clearly lists EPA, DHA, phospholipids, and purity testing. Take it with a meal containing fat. Give it time. Often 8 to 12 weeks before judging comfort, stiffness, and mobility. Track your neck rotation, morning stiffness, headache frequency, and rescue medication use. Do not rely on memory. Memory bends around pain. Also ask, who should be cautious? If you have a shellfish allergy, avoid krill oil unless your clinician specifically advises otherwise. If you take anticoagulants, antiplatelet drugs, high-dose NSAIDs, or you have surgery planned, speak with a clinician first. If you are pregnant, nursing, managing atrial fibrillation risk, or using prescription omega-3 therapy, do not self-prescribe high doses. The NIH Office of Dietary Supplements notes that omega-3 supplements are generally associated with mild side effects, such as unpleasant taste, heartburn, nausea, gastrointestinal discomfort, diarrhea, headache, or odor changes, and that high intakes may require attention in people using blood-thinning medications. Now connect the biology to the daily life of neck pain. Imagine a person who wakes with a stiff neck, checks the phone immediately, rushes into work, drinks coffee, stays at a desk for 6 hours, skips movement, clenches the jaw during stress, then wonders why the neck feels like concrete at night. In that person, krill oil alone cannot solve the pattern, but it may help reduce one layer of the biological load while the person rebuilds better inputs. So give clear instructions. First, move the neck gently every hour. Do not wait for pain to become loud. Rotate within comfort. Glide the chin slightly back. Let the shoulder blades drop. Second, strengthen gradually. Use deep neck flexor work, scapular stability, and thoracic extension. Why? Because a neck without support becomes a neck under constant negotiation. Third, reduce inflammatory pressure from the whole diet. Add oily fish if appropriate. Add colorful plants. Reduce ultra-processed foods. Balance the omega-3 strategy with the rest of the plate. Fourth, use krill oil consistently if it is safe for you. Do not take it randomly for 3 days and declare failure. Biology does not remodel on your impatience. Fifth, watch for red flags. If neck pain follows trauma, comes with weakness, numbness, fever, unexplained weight loss, severe headache, loss of balance, bowel or bladder symptoms, or pain that wakes you relentlessly at night, seek medical evaluation. Do not hide serious symptoms under supplements. Now ask, how exactly might krill oil make the neck feel better? It may help by altering cell membrane fatty acid composition. It may help by shifting eicosanoid production. It may help by supporting the generation of specialized pro-resolving mediators. It may help by lowering the background inflammatory tone in some individuals. It may help by making movement feel less threatening, which allows exercise to do its deeper work. And it may help because chronic pain is rarely one switch. It is often a panel of dimmers. Krill oil may turn one dimmer down, but remember this command: measure the outcome that matters. Not the marketing claim, not the ocean image on the label. Measure your ability to turn your head while driving. Measure how long you can work before stiffness builds. Measure morning tightness. Measure headache spillover. Measure whether you need fewer rescue pain medicines under medical guidance. Measure life. So here is the main message. Krill oil rich in omega-3 may benefit neck pain not because it mechanically fixes the cervical spine, but because it may support a healthier inflammatory and pain signaling environment. Chronic neck pain can involve more than muscles and joints. It can involve immune signals, sensitized nerves, guarded movement, and a body that has not fully returned from alarm to repair. Use krill oil intelligently. Pair it with exercise. Pair it with posture breaks. Pair it with sleep. Pair it with clinical care when needed. Ask, why is my neck still guarded? Ask, how can I lower the total load on the system? Then act patiently and consistently. The best strategy is not one capsule, one stretch, or one appointment. It is a coordinated plan. Calm the chemistry, restore the movement, strengthen the support, and teach the nervous system that the neck is safe again. Take care of your body, take care of each other, and keep learning as one health-minded family. I'll see you in the next topic.